Okay.
Good afternoon, everyone. This is Kit here with our new girl Cheyenne and our veterinarian, Dr. Daniels. And we are doing the official veterinarian intake procedures that we do anytime we get horses into this nature. And the little lady you hear talking it up in the background is Pocahontas, who doesn't like to be separated from Cheyenne.
All right.
So, Dr. Daniels is this is her first physical examination of these guys. And we have seen several other horses today, and we saved these guys for the last because they are in quarantine, and we didn't want to introduce anything to them.
She's not really letting me grab her tongue and look at her teeth. I would say she's got some dental abnormalities just from, I can palpate her teeth through the jaw, through the cheek, which she doesn't like, so she's probably got some sharp points
and
there.
edges, yeah.
Mm-hmm. She's got some, what people would call cataracts, old age cataracts. They're not really, they're just an age-associated change in the lens, but that's why you see a lot of old horses that are cloudy in the lens, but you can see. But a lot of times they're a little bit spooky and low light. Looking at your gum color. But she's sort of typical old horse pale pink. And you will see some old horses that are a little bit yellow in the whites of their eyes, so that may be normal for her.
Yeah,
Although, it may be worth running some just intake blood work on her because of how thin she is. Gives us an idea of how fast we can feed her.
Yeah, we're starting them on basis slow, like the 6 times a day.
Just a straight alfalfa.
And a little of the soaked pellets, and then just a handful of the straight alfalfa.
And you can tell she's older, from her teeth and from her little white hairs.
And she drinks an exorbitant amount of water.
Yeah, so I think we'll probably need to run some screening blood work.
Basic diagnostic. So I don't know if the viewing audience was able to hear that. So common when we get horses in this type of condition, we do some foundational blood work. Chem profile and a
CBC and a
CBC,
chemistry
to see where all their vital organs are at.
She has a really loud heart murmur,
which is not surprising. It's typical of most horses that we take in this condition. Some horses are able to grow out of that with nutrition, and some will maintain that same grade of heart murmur.
She doesn't have any other symptoms of heart failure. She doesn't have jugular pulses or anything like that.
Are you able to hear that okay?
I hope so, because we've got her in the background too, so I gotta keep that in mind.
What Dr. Daniels was saying is that she doesn't present with any other heart abnormalities, which would be a more pronounced jugular. So the only thing she's been able to pick up on right now is just the, what grade would you say that is? Heart murmur?
I would call it, hang on. Depends if I can hear it over here. I would call it a grade 4 because it radiates to the right.
Yeah. So Dr. Daniels was just saying that she would call it a grade 4 heart murmur because it's radiating to the other side as well.
She has normal gut sounds and normal lung sounds.
Oh, that's good.
In looking at her legs, and I don't know if you can get that on there, Karen, but you can see where she's really severely dropped in the pasterns, and she probably has DSLD, which is degenerative suspensory ligament desmitis. So the suspensory ligament is part of what kind of holds the whole leg together. And it's common, especially in Pasapinos and Peruvians, but some other breeds, to have it sort of break down over time, and so then they drop in their fetlocks. Doesn't look as though she has it in the back, but she has it in the front. And it just varies from horse to horse whether it's truly painful or not, or if it's just sort of heading south. She's not real sometimes they'll get really soft and painful when you palpate the legs. I think she's just sort of settled in where she is now. But they are at risk of dislocating their coffin joint, which is not pretty if that happens. She also has a mass on her abdomen over here. on the side of
Yeah,
her-
we had a touch base on that too.
Oh, she's got a
What is it?
she had a body wall hernia right there.
Yeah, that's what I was wondering.
Yeah, I can actually stick a finger in it, and I can reduce it completely.
Okay.
So she probably had a tear in her body wall right there at some point.
So is that something we would need to be concerned about at this stage?
I don't
or-
think so. I think it may just be the hole's big enough that I don't think anything's going to get entrapped in there.
Okay.
I mean, I can almost get 2 fingers in the hole.
Wow.
And then I can reduce it completely. But I don't think that she's at risk for
Okay.
anything getting stuck in there.
And what would you call her body score?
Probably 1 something.
Yeah.
1.5 maybe. I
Maybe.
mean, she's. I mean, when we're looking at body condition score, obviously we look at whether we can see the ribs or not, and hers are prominent. But then there's also this shelf of bone here, which there's basically no covering at all. You know, the vertebrae have like a dorsal spinous process, and then a process that goes out to the side, and that kind of makes that shelf where they hook into the ribs. And she's got nothing there. And same thing back here on her pelvis. You know, this should obviously all be filled in with muscle, and she has essentially no muscle back there. I mean, she's almost as thin as a horse can get. I mean, the good thing about her is that she's bright, she feels good, she wants to eat.
Oh yeah.
I would say that the biggest thing I see, not here, obviously, because you guys know what you're doing, but I'll see people going to rescue a horse, and they'll take a horse like this and feed it too fast.
Exactly.
And they can get really, really sick. They can die from it.
And
Because
with-
because they're all the microvilli in their intestines become blunted from starvation. So if you suddenly feed them a whole bunch, especially of carbohydrates, then they can get severe diarrhea, electrolyte abnormalities, and actually die from that. So if you feed them like what they're doing here, where they just get small amounts of alfalfa, like 6 times a day, and that's all they get. It takes a little while for those villi to regrow and to be able to deal with food. And one of the things that we'll look at on our blood work too will be her protein levels, and I mean besides liver, kidneys, and white blood cells, red blood cells, but we'll look
anemia.
at we'll look for anemia, and then her protein levels I suspect will probably be low, and a lot of times they have electrolyte abnormalities as well, just because their intestines cannot function properly without proper nutrition.
And what we, I guess we would refer it to as a refeeding syndrome, when people refeed a horse too fast for their ability to be able to handle the burden of the what would be proper nutrients for a horse in good condition.
And you put them at risk for laminitis too. I
Yeah.
see it a lot where, you know, it's almost like kill them with kindness. You had to just take absolute baby steps. And it's hard to do because you look at them and they're hungry, they want to eat, you want to like feed this horse, but it's really the worst thing
And
you
they're
can
not,
do
and they're
for
not in a position to self-regulate. So whatever you would put in front of them, they're going to eat.
this horse would eat herself.
Yeah, she would eat herself into a bad state.
I'm going to grab a couple of blood tubes and hopefully she'll let
So she's being a little feisty now. She's like, she knows her alfalfa's waiting for her. Don't be nibbling on Aunt Kit's hand.
So, Kit, over the years, we've had horses that put weight on faster than others, and
It's all individualized.
Yeah.
You know, you've heard me mention before about our senior horses. We had a horse that was in our care, that the individuals that had this horse prior to us getting him swore no matter what they did, they could not get this horse to gain weight. And he was 30 years of age and put on weight the quickest we've ever seen. And this is with our strict refeeding program. They simply were not feeding the horse.
Okay.
And but every horse is different and how they will cover. Not only that, if a horse has been through this process numerous times, meaning it wasn't its first time being starved to death, that can impede a horse's ability to be able to rebound. So we don't know the complete history on these horses, but we do know through a prior veterinarian's records that this level of starvation occurred within a year's time.
Okay.
Alrighty.
Oh, aren't you a good girl?
Dear. So Dr. Daniels has a theory that the Paso Finos are always really good with needles. I didn't want to say that before she poked her, though.
I think they're one of the great misunderstood breeds.
We see so many
Paso
of these
Finos
horses.
and thoroughbreds, and I mean, you see so many of both.
Yeah,
And they're both great breeds.
they
And
are. They're
I have an
wonderful.
appreciation for both, and yeah. But I always think you have to work pretty hard to make a Paso this thin.
Exactly. I mean, from
Yeah, I mean, they're
literally
easy. They're
there's
easy.
like
I mean,
handfuls of feed to be
yeah.
able.
Not
for
that it's
them
okay for a thoroughbred to be thin, but I see it all the time that people get a thoroughbred and they've had quarter horses forever, and they call me out and they say, "What's wrong with this horse?" You know, and there's nothing wrong with it. It's just a thoroughbred, and they don't know how to feed it appropriately.
Yes.
But with the Paso, we see way more issues with overfeeding and laminitis and insulin issues.
Because they're virtually like air
they're
plants for the most
Yeah,
part.
they're such easy keepers. So you really have to work hard to make
And
one
so
this
it's
thin.
yes, and it's
You're a good
it's
girl.
easy to see
Yeah.
why that they why she's in this condition. They had absolutely no forage provided for them at all,
I mean,
which
we'll
is
make
a
a
mainstay. Mainstay.
We'll
of
make a
a
plan to
horse's
look at her
race.
teeth and see, she may have some
Yeah.
dental abnormalities, but she's able to eat the alfalfa fine. She's not making, because, they
Yeah,
would,
she is.
they would make kind of spitballs where they chew up and it falls out.
no quitting.
Yeah. So,
And,
makes me think she's got a decent mouth. I'm just not going to upset her by trying to look at it right now. We'll just sedate her and do her teeth
and she's
after
she's
she
got a
settles
little
in.
rain rot stuff going on in her,
Yeah.
I believe, and so we're just going to give her
Yep.
some time to settle in
Poor
before
baby.
we pursue doing that. And Alicia will be out here to look at her hooves on Thursday, actually.
Yeah, and there's not a lot really, even like shoeing wise, anything like that. There's not a lot to do because it's not even. I would say I can't stand a degenerative process, because if it's an inflammatory process or something like that, you can change the mechanics or you can put them on anti-inflammatories, whatever. And with DSLD, it is what it is.
Yeah.
She's got some fluid in her. A little bit in her fetlock as well, and that may just be from stress on it, because of the core mechanics.
Yeah.
The only thing you can really do, sometimes you put a shoe on, you don't want to wedge them up, because that actually will increase the tension on the suspensory. But a shoe with
Like
an
a bar,
extended heel,
Yeah, we tried that. Remember,
Yeah,
with
because a
Freddie
little
we
caudal
did before.
support,
Yeah.
Can help. The problem is doing that on the front end. You can't put too much. You can put a lot more of a trailer on if they have it in the back end.
Mm-hmm.
In the front end, then they step on them and rip them off and
Yeah.
whatever. So I'm not sure there's anything much to do except keep her happy and comfortable. And she seems actually reasonably comfortable. I have a mare of my own, a thoroughbred mare that has it pretty badly in the back end, but she's pretty sound on it. It's just low.
She's like, okay, enough of this chitter chat.
You good girl.
Where's
Go
my
back to your alfalfa.
Hi, ladies.
Hi.
And Jeff.
So we're going to take a look at Pocahontas next. Jeff, you want to hold Pocahontas?
Now, of course, this is the best place for us to quarantine them at the time, keep them out of the heat. keep them away from the rest of the horses. They have the station set up, the ag wash, everybody sprays down, all the way from head down to feet when they're done over here.
Hey Brenda, can you try?
So sometimes when we have a situation where two horses come from the same place and are in vastly different body condition, I'm not saying she's in good body condition, but she's not horrible like Cheyenne. Chances are they were eating together and she was just eating whatever they were eating, getting more of it, And she's a little bit younger.
There was definitely no separation available for the two horses.
Yeah. Which I think in general, unless if you have two horses that live together and eat together, you need to know what the pecking order is, and if it's such that one isn't getting anything, then you got to change things. And even sometimes that means tying them in at buckets, or my preference is always just to build little feed pens. So even horses that live on pasture,
You can
can
just
have
do little pins like this.
little
even.
pens with a panel or with boards. Just make a little pen. So you really, if you have two horses, you only need one pen,
Exactly.
and that way they can kind of eat
And then you have some knowledge of exactly what each horse is consuming. One of the things we did notice when we went to this property, there was absolutely no visible signs of water for these horses whatsoever.
Wow.
None. We looked and looked and could not find any.
Huh. And how they're alive is.
Yeah.
And she's got the same kind of age-related changes in her lenses. She doesn't see how white the whites of her eyes, the sclera, it's nice and white, whereas Cheyenne's was yellow, which might be normal for her, but we're going to check that out on the blood work. Now, is she crib? I think she might. See how she has basically no incisors on the top.
Yeah.
And that's a lot of tartar. I might need to get my pliers. Look, can you see that, Karen? The wad of tartar that's there.
Oh, wow.
That's all that is. I mean,
Yeah.
I see it most commonly in older geldings because it tends to be right around their canines. But she's got it. Oh, she's got canines. I think she has canines. Yeah, I can't get that. I'll get my my pliers in a little bit
Just to see.
and just get that off of there.
So
Does she
what
let
do
you
you
look
mean
at
by
her
saying
teeth?
she has canines?
Canine teeth. It's mostly a male thing. And see, she's got a much better mouth. I mean, she's letting me look, but her teeth really aren't. Her teeth are not terrible,
Good. Well, that's
except for her
refreshing news.
incisors.
Yeah. Won't need the Dremel on those.
No.
That's why we do these, Marilyn, so you guys can see what goes on and learn when we have the professionals out.
Easy, baby.
So you can look. Her feet are in pretty decent. I mean, they're overgrown, but they look like she's got pretty good feet.
I'm
Normal
imagining
heart rate
Oh, that's good.
and normal heart sounds.
I didn't know if the audience heard that, but Dr. Daniels said that she was having a normal heart rate and sounds.
Good.
No detection of a heart murmur at this point.
I mean, and you can look at this horse and say she's healthier. I mean, just based on her body condition. See how you can. I mean, she still is thin, but has much better cover on her ribs and her back. And she's supposedly 20.
20, was it 4.5?
Oh, okay.
Yeah.
Which obviously, I can't really age her by her incisors because...
And I'm surmising the veterinarian that saw them over a year ago did not have any prior records on them as well, and probably did the
Right.
best job to guesstimate based on their
Yeah.
dental
Yeah. They,
observations.
I mean, obviously she needs her feet done as well. They're kind of broken up.
Be interested to know if your opinion on if any arthritic conditions
Yeah.
with her.
Yeah, she's broken up, but she's got, pretty good feet. She definitely looks like she's had some sort of injury or arthritis to her left hock. She's got a large swelling, and it's not just you look at it and you think, oh well, maybe it's just what we would call like a boggy hock, which just has fluid in it, but it's actually a large bony swelling. So I'm guessing she had some kind of injury to the inside of that hock, either a kick or I don't. It's probably not just arthritis where it is, but she's got
Some kind of arthritic reaction to a prior injury.
Yeah. See it. She doesn't really mind that, so that's good. And it's not like she's hobbling, So she's tolerating it pretty well.
Whoa.
All right. And I didn't look on. Yeah, see, she's probably had foals, a foal or foals. I didn't look on Cheyenne.
Yeah, she just looked like she's
Yeah,
had
I
some. If you
mean,
can look under her.
She definitely, you
teats.
can tell by
hard to
the
see.
elongation of the teats there that she's, probably had foal or foals. You wish they could talk and tell you all the places they've been.
Well, she's definitely.
What?
Yeah.
But the picture I sent you
Yeah.
saw. Yeah.
She does?
Yeah. She's yeah.
Oh, yeah.
A lot more
Yeah, yeah.
than-
Yeah, which would be interesting to know where they came from.
Look, she's got a brand.
We can't, what?
She has a
Yeah,
brand.
yeah. Yeah, but who knows how long ago. And I don't
Yeah.
know.
And here
Like, I know with quarter horse brands you can look them up, but I don't know with
so
Massachinos.
some of them we can delve into. We have some Paso folks that follow us that might be able to help with that.
Yeah. I mean, not that it matters.
The story we get, and that's what we always say, it's a story because we are not necessarily able to validate the truth of what we're receiving.
Right.
And the story is that these horses were on a property that was being sold to another individual, and the other individual didn't want the horses. So if they didn't want the horses, they were going to be put down, and the individuals that signed these horses over to us had agreed to take them in as to not have them be put down. But they did.
Well, and I see it all the time, and you probably do too, that it's not really out of, they didn't get the horses with the intention of starving them. It's just that a lot of people don't understand what is necessary to take care of horses and get in over their heads. I see people all the time that say they're rescuing a horse and they don't have the knowledge. I mean,
Yes.
you guys know the knowledge it takes to truly rescue a horse.
Rescuing a horse is
yeah.
a lot more involved
It's
than
a-
just
yes.
physically taking or ownership of the horse.
Yeah, and usually there are a variety of issues, and you have to have the knowledge and the veterinary relationship and the farrier relationship and the money to
And
do it.
if you don't have firsthand experience doing it,
Right.
you definitely need to rely on the expertise of other individuals, and which is going to require a lot more cash
Right.
flow to be able to
Right, it's not
do.
that you can't do it, but you have to get the right experts, and also you have to be willing to do what it takes. And
Yes.
I see a lot of horses that end up, and I know you do, that
Yep.
you're rescuing from people who rescued them.
Yes.
Because they just didn't know, so.
But there are loads of individuals out there that have that knowledge. So before you proceed with rescuing a horse, you would need to contact a local veterinarian. You could rely on other people in your area that have horses for referrals to experts and farriers and equine veterinarians. But there is plenty of knowledge to be had out there, so you never should try to fly it and do it solo.
Yeah, and I would trust the experts as opposed to.
Yeah, and you can't, and this
if
is
you walk
not,
into Tractor Supply and ask a question, you're going to get a lot of different answers, but
Yeah.
they may not be, based in true veterinary knowledge and that kind of thing. It's
And
more,
these-
mostly horse owner experience, which I don't discount, but when it comes to, especially to rescuing a horse, not everybody really understands, like we were talking about with Cheyenne, about refeeding syndrome and those kinds of problems. So.
and sometimes we have, or frequently we have individuals seeking information from us regarding a rescue that they took in. We cannot advise on those situations because we don't have firsthand knowledge of the horse's health condition. So it's always best that you are working in concert with a veterinarian who can best advise you on what to do for that rescue horse.
So on her, I don't know that we necessarily need to run blood work on her. I
Okay.
mean, her color's good. She doesn't have a murmur. Her, body condition is better. All of that. So I think, I still would proceed kind of the way you're going to with Cheyenne, but she's going to come back, I think, a lot faster.
Yes.
The only other question is like parasites and fecal.
Yeah, that's what it
and-
was like. What do you want to do with respect to that?
My preference would be to not do teeth, deworming, any of that for at least a few weeks.
Okay.
Just let them settle in, especially her, make sure she's going to be okay as we, go along, see what the blood work looks like, and then once we get them in a little bit healthier plane of nutrition, then we can, we could run a fecal, but we could also just deworm them in it. But I don't like to do it all at one time. Like I know the other passos that came in had a lot of stuff done at one time, and I think it's a little bit,
Much, yeah.
can be a little bit much, especially with her condition. Plus we don't know if she has liver problem or whatever that, a dewormer might send her
So
over the
maybe
edge.
once we get her blood work back, that would give us a better idea
Yeah.
on her, and maybe we wait and make a judgment call from the blood work on when
Yeah.
we warm them.
Yeah, and we could grab some manure and do a fecal if we
Yeah.
wanted to now. And most mature horses have pretty good natural immunity to parasites, but then as they get older into their 20s, that starts to decrease. So they're very young and very old, you have to be way more diligent about your deworming. You can kind of get away in the middle years, especially if horses are on pasture and there's not a high stocking density. But a big cause of weight loss in older horses is parasites because they just don't have the immunity to it. So
Yeah. And then we talk about colic. Horses can actually colic from being wormed and throwing an enormous amount of deceased parasites in their system, thus causing a colic. So we definitely want to
yeah,
take our time, and especially with Cheyenne.
yeah,
Yep.
yeah. So I think we have a plan, and we'll reconvene when.
Okay.
When we have
Sounds
the blood
good.
work back, and then in a couple weeks once they've settled in.
Okay.
How long have they been here?
Would we get them in on
11th, I think.
Last Thursday, 4 days.
It's all a blur.
Last Thursday.
Yeah,
Yeah.
but not even a week, right?
Yeah.
Yeah.
Yeah. So I'd give them 2-3 weeks to settle in, and then we can talk about doing teeth or whatever else.
That sounds good.
All right, girlie.
So we'll sure be seeing Dr. Daniels out here sooner than later.
Okay. All right. Thanks,
And
everyone.
we'll have a
Yep.
discussion on our any changes in our plan of attack and how we'll be proceeding with these guys and reports on the blood work, etc.
Okay.
Alrighty, but
Thank
as
you.
you can see, these guys are ready for their meals.
Yes. Have a great day.